Hello, my name is Helen Johnson. I am part of a multi-center group studying the omission of breast cancer surgery for invasive cancers through a phase 2 clinical trial. We are delighted to share the results of the feasibility phase of our trial in this issue of JACS. We hypothesize that select patients with invasive breast cancers that have a pathologic complete response to neoadjuvant systemic therapy may be able to safely de-escalate local therapy. Specifically, it may be safe to forego breast surgery and proceed directly to radiation therapy. To test this hypothesis, we designed a prospective, single-arm clinical trial with a primary endpoint of ipsilateral breast tumor recurrence. The trial was divided into two parts. The first phase was designed to evaluate feasibility and enrolled 6 patients based on a priori calculations. If none of these patients had an ipsilateral breast tumor recurrence within 6 months of completing radiation therapy, the trial would progress to the second phase with an enrollment of 50 total patients. This schematic shows the trial design. Enrollment was limited to women aged 40 or older with early stage invasive breast cancer, either triple negative or HER2 positive, as these subtypes have the highest rates of pathologic complete response. 13 women were evaluated for the feasibility phase. After completing neoadjuvant systemic therapy, patients underwent standardized image-guided vacuum-assisted core biopsy of the tumor bed, which our group has previously shown can accurately predict pathologic complete response. 7 patients had pathologic evidence of residual disease and were taken off study so that they could receive standard breast surgical therapy. The remaining 6 patients did not undergo breast surgery and proceeded directly to radiation therapy. Patients with clinical N1 disease underwent targeted axillary dissection to evaluate for axillary pathologic complete response and were eligible to receive nodal radiation in addition to whole breast radiation. At 6 months post-radiation therapy, patients were evaluated with history and physical examination, as well as diagnostic breast imaging. None of the patients in the feasibility cohort had an ipsilateral breast tumor recurrence. Therefore, the trial progressed to the expansion phase with enrollment of 50 total patients. At this time, none of these patients have experienced an ipsilateral breast tumor recurrence at a median follow-up of 32.4 months. The results of the feasibility phase of this multi-center trial suggest that it may be safe to omit breast surgery for highly selected patients with invasive cancers that have an exceptional response to neoadjuvant systemic therapy. While promising, these are early data, and we await the 5-year results for the initial 50 patients in the expansion cohort, and now a total approved 100 patients on trial due to increased patient and physician interest.